Swollen ankles, 6 warning signs you shouldn't ignore. You wake up, slide your feet into your favorite shoes, and they don't fit. Your ankles are puffy, your socks left deep grooves in your skin, and you think, I must have eaten something salty last night, and you go on with your day. But if you're over 50, that swelling can be your body waving a red flag. And a few of those flags are the difference between staying active for decades and landing in a hospital bed. In the next few minutes, I'll walk you through 6 things your swollen ankles could be warning you about, which ones can wait and which ones absolutely cannot, and exactly what you should do about it today. Hey, I'm Dr. Mauldin. On this channel, we play health detective. We don't just chase symptoms, we hunt down the root cause of what your body is actually trying to tell you. If that's the kind of straight talk health information you've been looking for, do me a favor right now. Tap that like button, hit subscribe so these videos find you, and check the links down in the description. I've put my favorite resources there for you. All right, let's get into it. Number 1, the heart connection. Start with your heart. When it can't pump at full strength, blood backs up in your veins, and fluid gets pushed out into your lower legs and ankles. Nearly 7 million American adults are living with heart failure, and for a lot of them, puffy ankles were the very first clue, dismissed as too much salt or a long day on my feet. The tell? Swelling in both ankles that slowly gets worse over days or weeks, often paired with shortness of breath, especially when you lie down at night. If that sounds like you, don't wait it out. A simple EKG or ultrasound at your doctor's office can show exactly what your heart is doing. Number 2, your kidneys sending an SOS. Next, your kidneys, your body's filtration system. About 1 in 7 American adults has some degree of kidney disease, and most don't even know it. When your kidneys start to slip, your body holds onto fluid, and it pools in your ankles, your legs, sometimes even your face and hands. But the clue is rarely the swelling alone. It's the swelling plus the extras, more fatigue than usual, blood pressure that won't behave, urinating less often, or noticing a change in color. Stack those together and your kidneys are asking for help. The detective move here is simple and cheap. A basic blood and urine test tells the story early while you still have room to protect them. Number 3, blood clots are quietly dangerous. Now the serious one. A deep vein thrombosis, a DVT, is a clot in a deep vein, usually in your leg. After 50, after surgery, or after long stretches sitting still, a flight, a road trip, weeks home on the couch, your risk climbs. Here's what makes clots tricky. About half of people with a DVT feel nothing at all. But when it does announce itself, it's classic. Swelling in just one ankle with pain, warmth, or redness. So hear me clearly. If your swelling came on suddenly in one leg and it's painful, warm, or red, this is not a schedule an appointment next week situation. Call your doctor today or go to the emergency room. If that clot breaks loose and travels to your lungs, it becomes life-threatening. An ultrasound can rule it out in minutes. Better to go and be wrong than to stay home and be right. Number 4, thyroid hiding in plain sight. Here's one almost nobody connects to their ankles, an underactive thyroid. Your thyroid runs your metabolism, your body's whole energy system. When it's sluggish, everything slows down, and your body starts holding fluid in odd places. Thyroid swelling tends to be puffy and doughy rather than tight and stretched. And this one's personal for the women watching. After menopause, thyroid trouble becomes far more common, and the signs hide in plain sight. Fatigue, thinning hair, weight creeping up while you're eating the same as always, and now swollen ankles. The good news? It's one of the most treatable things on this entire list. One blood test, and if your levels are low, the right support can turn it around. Energy back, swelling down. Number 5, liver disease shows up in your legs. Your liver does more than 500 jobs, and when it's struggling, your ankles can be one of the first places it shows. A stressed liver can't make enough albumin, the protein that keeps fluid inside your bloodstream where it belongs. Without enough of it, fluid leaks out into your tissues. Liver trouble is famously quiet. You may not feel sick at all. so watch for the companions: yellowing of the skin or eyes, easy bruising, a swelling belly. Any of those alongside ankle swelling is a same week conversation with your doctor. And here's the hopeful part. Your liver is one of the few organs that can actually repair itself when you catch the problem early and give it what it needs. Number 6, infection spreading underneath. Last one, infection. Cellulitis is a skin infection that makes an ankle swell up suddenly, red, warm, tender, and it can spread fast. Bacteria slip in through a crack in the skin so small you never even saw it. After 50, with a quieter immune system or diabetes in the picture, this turns serious quickly. And here's the trap. Older adults often don't spike a high fever even with a real infection, so it gets brushed off as just a little swelling. If the skin around your ankle is red, warm, and tender, especially if you feel off or feverish, get seen. Caught early, it clears up. Ignored, it can climb the leg and put you in the hospital. What can you do right now so you've got swollen ankles? Now what? Play detective with me. First, the pattern. One ankle or both. Sudden or gradual. Painful, warm, or red. Any shortness of breath, fatigue, changes in urination, or yellowing skin. Write it down. Your doctor will want every bit of it. Here's the rule of thumb. Sudden, one-sided, and painful, warm, or red, treat it as urgent. Call your doctor or head to the ER. Gradual, both sides, no pain. You've got a little more time, but don't ignore it. Book an appointment and ask for blood work on your thyroid, kidneys, and liver, plus an ultrasound if clots are a concern. In the meantime, the gentle basics. Elevate your legs when you sit, ease off the salt, and keep moving so the fluid can clear. Medication has its place here, and your medical doctor will guide that. My job is to make sure you catch the root cause early. Swollen ankles are your body talking to you. Most of the time it isn't an emergency, but it's always worth investigating because you've spent 50+ years building this life, and you deserve to stay active and enjoy every bit of it. If this helped you, hit that like button so it reaches someone else who needs it. Subscribe for more root cause health and check the links in the description below. I'll see you in the next one.